Hey, welcome to Gen X Medic. It's been a while since I've been here. Let's talk. We're going to talk about a drug that I like, drug I use occasionally. Would use it more often. Fortunately, I've not had a need to, recently at least. The drug's called ketamine. It's been really controversial lately, and we're going to have several videos on this. Because first, before we start talking about the controversy and the hype, we need to talk about what it actually does. It's a dissociative and an anesthetic. First created in 1962, approved in 1970 by the FDA, and was used extensively in Vietnam. It's funny, ketamine is actually a drug that the military really likes. Why? It works well. In EMS, we tend to use it for induction for intubation, pain management, and for often with an adjunct with opiates. And we use it as a sedative. That's where it really gets into the issue, is when we use it as a sedative. Because in reality, using this drug as a sedative is controversial to people. Using any sedative is controversial. Why? Because when you do that, you're knocking someone's level of consciousness down. So the dosage for EMS usage tends to be for sedation. They'll use intramuscular 2 to 4 milligrams per kilogram. Let's be honest, you should always start low. Don't shoot it all right off the bat. If you're doing that, you're just setting it up where you're going to have more issues. IV dosage for sedation is 1 milligram per kilogram. That's the normal dosage pretty much everywhere I've looked. Pain management. Often it's used in conjunction with an opiate. It's 0.1 to 0.3 milligrams per kilogram. So you don't take a lot to take the pain away. Man, this drug is extremely safe when used normally. Like I said, we're going to get into some of the controversies and some of the issues. One of the things, I'm trying to reach out to a couple of journalists and YouTubers to get more information on what came up in a trial. Yeah, it's been that controversial. But you've got a basic loading dose, something easy to use, and there's been some ridiculous levels of overdosing with this drug and no issues. So let's talk about how bad does it have to be. So remember, I just said that the intravenous dose is 1 milligram per kilogram. So I looked up the material data safety sheet on it. The lethal dose 50, what it takes to kill a human, technically LD 50 means 50% of all people, but is 56 milligrams per kilogram. 56 milligrams per. You can give someone 56 times the suggested dose and it'd be fine. Or that's what it takes to kill somebody. Sorry, they won't be fine, but 56 times the dose. I want you to think about that. There is no other drug I know of that the effective dose versus the deadly dose is that far apart. Now let's talk about some of the other uses for this drug. Since this drug was invented in 1962, it's been in constant use. You'll hear the media talk about it being a horse tranquilizer because, well, let's be honest, it's the media, and hey, that sounds sexy and horrible, and it gets your attention. It's a normal drug. It's actually, the World Health Organization considers it a necessary drug. That level of amazingness that the World Health Organization considers it a drug every place should have. They found, well, they noticed in the Gulf War, and the one that a lot of my friends were at in Iraq and Afghanistan, global war on terror, that patients who had PTSD, or correction, patients who were treated with ketamine as an analgesic had lower levels of PTSD. So they started researching that. They found that it's a great drug for on people who have self-deletion ideas. Sorry, YouTube, gotta clean it up. PTSD, depression, they can do ketamine infusions, and it works when it's not worked for anything else. Nothing else has worked to help these people. Ketamine works. Not always, but it's got a good level of efficacy for that. It's a black label use. Insurance won't pay for, which is kind of difficult. Okay, insurance not paying for it's stupid. It's cheap, it's easy, it works. So, remember I said that the LD50 is 56 milligrams per kilogram, and the average human adult, a 75 kilogram adult, would take 4.2 grams to kill them. So we're talking about a drug that it's really difficult to actually kill somebody with it, and a drug that has a ton of uses. And the big controversy really is over sedation. So what did we do before we started sedating patients? Well, we'd sit on them, we'd tie them down, and there was the old habit of sandwiching combative patients between backboards. All these are actually worse for patients than sedating them and getting them into the hospital. Now we're going to talk about this more because this is important, because there was a recent case in Colorado where medics got convicted. That's going to come out next week, and we're going to talk about it, and I'm going to be pretty harsh about it. But I want you to know I'm not here to make excuses for anybody. I'm going to tell you how it is. Folks, we have a lot of stuff going on where they're trying to take away good medication, trying to screw up good treatment, and let's be honest, it doesn't help EMS, it doesn't help any of us, it doesn't help our patients, it doesn't help the communities we serve. But you know what? We're doing it to ourselves sometimes. This is Gen X Medic. Let's not hurt ourselves. Thank you.